fatal shooting of Brian Thompson, CEO of United Healthcare, a U.S. health insurance giant, has ignited widespread commentary and criticism of the state of the U.S. healthcare system. There has been a lack of sympathy from some, along with advocacy for Luigi Mangione, an Ivy League-educated man from a wealthy family who has been charged with murder in the December 4th killing of Thompson on a Midtown Manhattan street. America has a hugely complex healthcare system. Unlike many other countries, the U.S. does not have universal healthcare, the only developed country that does not. Public health insurance covers only about 35% of the U.S. population, mainly people with disabilities, children, low incomes, and those 65 and older. The remaining 65% have to procure their own health insurance through private companies, usually through a jointly paid employer-employee insurance or commercial insurance purchased by an individual. In 2024, the average annual health insurance premium paid by an individual will be about $9,000, and the average annual premium paid by a family will be about $26,000, according to the Kaiser Foundation. The total direct premiums collected by insurers in 2023 was about $1.2 trillion, 2.6 times the amount collected in 2013, a decade ago, according to Statista data released in November 2024. Due to soaring premiums every year, about 9% of Americans do not have any health insurance at all. Many say they pay high premiums to insurers each year, but say insurers often appear uncaring when it comes to patients, putting commercial interests ahead of patients' lives. A thorny claims process, high premiums, and refusal of claims add to the frustration. This situation is caused by a combination of economic, political, and social factors. From the economic point of view, before the 1980s, the insurers provided complete reimbursement. That is, insurers pay for the doctor visit, and patients could freely choose any hospital or clinic. But that led to overuse of medical services, and the increase in medical costs put pressure on insurers. After taking office in 1981, former U.S. President Ronald Reagan greatly reduced government investment in healthcare and relaxed regulations in the industry, such as canceling nonprofit requirements for public hospitals and encouraging investors to set up for-profit medical institutions. In 1983, a law changed the way insurers provided reimbursement in favor of a fixed fee paid to hospitals and other healthcare institutions. So if healthcare providers can reduce costs, they make profits, and if they can't, they incur losses. From that point on, hospitals and other medical institutions acted like businesses, scrambling for revenue, opening new programs and services, etc. Healthcare providers focused on revenue and profit maximization rather than cost control. The deregulation of the Reagan era made investor-owned, shareholder-driven, for-profit corporations common in healthcare for the first time. To maximize profits, many insurers impose various restrictions, such as setting high out-of-pocket costs, limiting medical choices, and refusing to pay certain medical expenses. Insurers also work with medical providers, pharmacies, and auxiliary medical institutions to form a vast coalition of interests. If a patient does not go to a medical facility or pharmacy designated by the insurers will refuse to pay. So the insurance groups, such as United Health, control almost all aspects of healthcare. Healthcare spending in the U.S. is much higher than in other countries. Health Affairs, a peer-reviewed journal, released data in June 2024 that said that it is expected that U.S. healthcare spending will grow by 5.2% in 2024, higher than the growth rate of the GDP, and that healthcare spending will account for 17.7% of U.S. GDP, reaching about $5.05 trillion. What does that number mean? Total annual global health spending is currently about $10 trillion, and the U.S. alone makes up half of the world's healthcare spending. If the U.S. healthcare sector were an independent economy, it would be the third largest in the world, with a GDP behind the U.S. and China, and higher than that of Germany and Japan. Even compared with comparable developed countries, the U.S. spends a disproportionate amount on healthcare. According to the data from the Peter G. Peterson Foundation in 2022, Among more than a dozen developed countries, including Germany and Switzerland, the U.S. had the highest per capita annual medical cost, reaching nearly $13,000, which is almost twice the per capita medical cost of other developed countries. While America spends so much on healthcare, its health system performs relatively poorly. The performance of the U.S. healthcare system ranked at the bottom of 10 developed countries, including Australia and the UK. And the gap is wide compared with the top 9 countries, according to a report released by the Commonwealth Foundation in September 2024. The U.S. spends so much money on healthcare, but where do the funds go? The majority of healthcare spending is funneled to hospitals and doctors and for prescription drugs, according to the Peterson Foundation. In 2022, hospitals accounted for nearly a third of overall health spending. Doctors' clinics accounted for 19.8%, and prescription drugs accounted for 9.1%. There are currently 6,120 hospitals in the U.S., according to the American Hospital Association. Total hospital spending is about $1.6 trillion a year. When it comes to doctors' earnings, the average annual salary for doctors in the U.S. is about $350,000, with top doctors making 10 times that amount, the Washington Post reported. Roughly speaking, a doctor's visit can cost between $80 and $170. If hospitalized, the average day in a U.S. hospital costs about $3,000. The U.S. spends about $500 billion a year on prescription drugs. Forbes released a report last month that in the S&P 500 index, the market share of the healthcare sector ranks third, second only to the information technology sector and the financial sector. By market capitalization, the healthcare sector is worth more than $6 trillion. As of the second quarter of 2024, the healthcare sector in the S&P 500 had earnings per share of about $12.47, accounting for a large portion of overall S&P 500 profits. Politics also plays an important role in the healthcare system. With American politics increasingly polarized, any major reform will be difficult to push through. On the social level, the U.S. advocates individualism. Many people believe that healthcare is a personal matter, and the government should not be too involved in it. A report published in October 2023 in the Journal of the American Medical Association said that any effort to simplify the U.S. healthcare system would inevitably clash with business interests, adding to the challenge of simplifying it. The shortcomings of the U.S. healthcare system have become an urgent social problem and likely will require the cooperative efforts of government, insurers, medical institutions, and society to achieve medical reform.